السلام عليكم. النهاردة تشرفت بوجودكم، وإن شاء الله تبقى محاضرة مفيدة للجميع. I'm so pleased to be with you in this lecture, and I hope everyone can get good information. Today, we are going to talk about the skin cancers and prevention. First of all, I want to introduce myself. I'm Dr. Iman Mohamed. I'm a dermatologist, and I'm working with Dr. Samiha Lutfi clinic. Now, I just want to confirm that everything is okay. Can you please confirm to me that the voice is clear and everything is okay? Can you hear me? Okay, everything's okay. Now we are going to talk about, first of all, what is the skin layers. First of all, we should know the thing that we are going to talk about. Actually, the skin layers is composed of three main layers. Number one is the epidermis, which is the outer layer from outside, and it should be renewed by your skin. Can you go back a little bit, Ms. Jamila? Because you are hiding. Yeah, thank you so much. First of all, we have the first layer outside, which is the epidermis. This is the outer layer, and it is renewed every 4 weeks. Second layer is the dermis, which is the vascular large layer. This is the main bulk of our skin. And the last one is the hypodermis, or the subcutaneous. The thickness of our skin, usually it ranges between 0.5 millimeter to 4 millimeter in the thickest part, which is in the palm and the sole. There is a three function. Next, please. There is a three function mainly for our skin. Number one is to protect our body, because this is our barrier, actually. Number two is regulating. This, we using our skin for regulating many things, to regulate our temperature, to regulate the sweat secretion, also to regulate the nerve sensation, how you are feeling things, hot or not. Last thing is sensing, and this is the main part, that our skin, we can feel hot, pain, or anything else. Next. Now we are going to talk today about the skin tumor. Next, please. Actually, skin tumors, as a name, it composed of main two parts, big component, which is the benign tumors and the malignant tumors. I know a little bit the medical information or the medical terms is a little bit difficult, but we will try to make it more easy for all of you. Benign tumors, it is simply a good thing. It will not harm. It very slowly grows, and it's not metastasis. Metastasis, that means it have the tendency to spread in the body. So benign tumors, it is the good type of tumors, and it's not going to transfer to something bad. The malignant tumors, this is actually what we call it the cancers, and usually it have a rapid growth, and also it have a potential metastasis that it can send some cells to different body organs, and it will affect it also by cancer. Next, please. And this is actually our main part to talk about, which is the most common types of skin cancer. Actually, skin cancer, we have many types and many different forms, but these are the three main common types. First of all, the basal cell carcinoma. This is the most common type. Secondly, the squamous cell carcinoma, and the third one is the malignant melanoma, which is the more aggressive. Next, please. Next. Yeah, hold a little bit. Can you come back? Now I will just show you something, because most of you coming in our clinic to just ask about some skin problems that comes suddenly or over term, yani over time, and they want to clear if it is something bad or not. These are, I will show you now, two types of benign tumors. The most common one, first of all, is the seborrheic keratosis. As you see here, you will see this in many persons. Usually this happens with people in elderly aged, in the sun exposed area, usually in the face, in the neck. Sometimes it happens also in the body and in the back. This totally benign tumor, nothing to worry about this at all. Can next please to see the second picture. This also another shape of it. This one, we usually removing it by just some lasers, ablative lasers, or even surgically. This type of seborrheic keratosis, you will feel something on the skin. Okay, yani you should feel that there is some elevation. If you pass your hands over it, you will feel that there is something like usually simply we telling it's like a gummy stick on the skin. Second type, which is actinic keratosis. Can we see the first photo? Yeah. Actinic keratosis, it's one of the benign tumors, but it's little bit risky. Why? Because actinic keratosis, if it appears on the skin, it's just coloration. There is no elevation on the skin itself. But when it is appears, if this skin is not protected well and not frequently examined, so this can get more harmful, and it can be pre-malignant and transferred to one of the cancers of the skin, which is squamous cell carcinoma. So actinic keratosis, once it's diagnosed, the patient should be cautious, and he should avoiding the frequent sun exposure for a longer period, especially in the peak time. Next, please. This also another shape of the actinic keratosis. As you see, it's not like the seborrheic. Seborrheic, you feel there is something above. Now we are going to talk about our topic, which is the skin cancers. Skin cancers, one of the most common diagnosed cancer in the medicine. Yani easily diagnosed. We can diagnose it and see. Can you go back? Yeah, thanks. It's one of the most commonly diagnosed cancers. Any persistent skin lesion that doesn't heal, highly suspicious for malignancy and should be examined. Once we have any skin lesion, we see it on our skin, and it's staying for a long time, we should seek for examination and to check if it is malignant or no. It's going have any potential effect to be transferred to something cancerous or no. So the early detection and treatment of most of these cancers, it really gives us a very good prognosis, and we will not get any complication later on. Next, please. What is the risk factors mainly that make some people more affordable to get skin cancer or no? First of all, the damage in the ozone layer. Yani usually before we was hearing the problem that the ozone have getting problem. Some people don't know what this will happen. Actually, there is the three types of our sun rays that can enter the ozone. Ultraviolet A, UVA, UVB, and UVC. In UVC, this is the most dangerous one, and alhamdulillah that it is already yani cannot pass the ozone layer. So number one, if the damage in the ozone layer is increased, so this will make us more and more potential to get skin cancers due to the ultraviolet rays. Number two, the fair skin people, the people who have a very fair skin type 1 and 2, the white people, they are more affordable to get skin cancers if they keep exposing to the sun for long periods and for long time without a good protection. This is because they lack the skin pigmentation. Usually all of us is having some melanocytes, which is inside our skin. It acts like an umbrella. When we expose to sun for a long period, it's giving like a dendritis same like the umbrella to protect our skin and also to protect the DNA in our skin. So like this, it helps us to protect from also the skin cancers. Fair skin people don't have too much melanocytes in their skin, the number of melanocytes. So because of this, they are more potentially to get that. Prolonged exposure to sun. Yeah, to be honest, that to expose the sun, it is something good. We can get vitamin D, warm, and many benefits. But if you keep exposing to the sun without good protection and not in a good timing, so this can make you in a higher susceptibility to get the skin cancer. Scars of severe burn. Some patients who's actually they don't have all of these factors, but they have a chronic scar. Any chronic scar, so either for the sunburn. Can you have next, please? Severe burn or even the skin irritation. Okay, chronic skin irritation, anything that can irritate the skin. Ms. Jamila, next, please. Can irritate the skin chronically for a long period. This can also make the skin in higher susceptibility to get a skin cancer or to be transformed, this scar, to skin cancer. Usually it transfers to squamous cell carcinoma. Last thing is the genetic factor. Genetic factor, usually this persons which have any family member, next please, have any family members who's already diagnosed with any skin cancer. Other family members should keep investigating themselves because they have more susceptibility also. Number one, now, next, please. We will talk about the basal cell carcinoma and how clinically it look like, also the squamous cell carcinoma and the malignant melanoma. First of all, the basal cell carcinoma, this is the most common type between all of the skin cancers, and thanks God that it's localized. What mean localized? It is invading the skin, but locally. So it's not it's not giving metastasis to different organs, and also it is non-invasive too much compared to the malignant melanoma and squamous cell carcinoma. Next, please. It appears usually on the sun-exposed areas of the body, and the incidence of its appearance usually depend on the age of the patient. So because of that, usually we see it in the elder aged people, and also the total amount of sun exposure. If the person also keep exposing for a long time without protection, also this increasing the risk of the basal cell carcinoma, plus the amount of melanin in the skin. So this happen usually with the fair skin people. So don't worry too much. Still, we are in the Middle East. Most of us having skin types can protect us again at this one, especially that we have a very good sun all over the year. Next, please. When the patient come to me in the clinic, usually what can I see? So it's a just to make it basal cell carcinoma, and I need to reinvestigate him. First of all, usually it appears like a nodule. What mean nodule? It's like an elevation over the skin, small nodule with a rolled edge. You will see like its edge as you are rolling it inside, and also it's barely looking with telangiectasic vessels. Sometimes we can see vessels in between. As it grows, it undergoes central ulceration. If the patient didn't treat it or didn't seek for attention or examination, usually the central part of it usually have the ulceration, and usually it appears on the face mainly, and the recurrence in this type is very common. Can we see the pictures? Example, next, please. As you see here, this some examples of the basal cell carcinoma. As you will see, it is elevated above the skin. Its edge is barely looking, like shiny little bit, and also it is rolled in. Next, please. This also another picture showing us some types of the basal cell carcinoma with a rolling edge. This another one, but this one he actually neglected, so we got the ulcerative form with ulceration in the basal cell carcinoma. Next. Now we are talking about the second type, which is the squamous cell carcinoma. Squamous cell carcinoma, it is a malignant tumor. The previous one, it was locally malignant, so it's not invading anywhere. But squamous cell carcinoma, no, it is malignant and it's more serious than the basal cell carcinoma. But thanks that it is not that much commonly occurring. Usually also it appears in the sun-exposed areas, and it is less common than the basal cell carcinoma, but it is highly aggressive. Because of this, once we suspect squamous cell carcinoma, we should take it seriously. It, as I told you before, it is potentially to have a metastasis in different organs, and also if it is neglected, it can lead to death. Okay, next, please. Next, yes. Clinically, how does squamous cell carcinoma appear when the patient comes to me? First of all, it is usually primary or developed from a precancerous lesion. This is what I'm talking about, that I told you that we can get skin cancer over a chronic scar, or from even the benign type, which is actinic keratosis. So squamous cell carcinoma can be primary, that it developed alone without any previous cause, or it can be also from the precancerous lesion or above any scar or ulcer. Patient who having chronic ulceration, it can also be transferred to squamous cell carcinoma. And this one of the very aggressive sequels can happen complication. It appears in different ways. It can be rough, it can be thickened, it can be scaly, have little scales on the top. Also, sometimes it coming with the patient that this ulcer or area is for long timing, and it is start to bleeding. Usually it's border, not like the basal cell carcinoma. Usually it is inflammatory, and also usually we're seeing it in the face, lower lips, in the ear lobule, and in the nose, and the forehead, and upper extremities in the hands. Can we see the pictures, please? This one of the squamous cell carcinoma examples that happen near the neck areas, in the upper extremity. As you see, it is too much ulcerated and too much locally aggressive compared to the basal cell carcinoma. Next, please. Here I bring for you two types. On the middle photo, as you see, this is basal cell carcinoma, which is the locally malignant and little bit less aggressive form. And on the right side, this is most right, the squamous cell carcinoma, which is ulcerative, and this is the most aggressive form. Now, next, please. The malignant melanoma. Malignant melanoma, it is cancerous lesion in the skin, and it is the most aggressive and dangerous skin type. Most dangerous and aggressive skin type. Because of this, we keep giving a hint to please keep examining your skin to avoid having malignant melanoma, and it's not discovered. It's caused, unfortunately, it's unknown, but usually because of the ultraviolet rays, and also it have a very familial tendency. So also any person have a family member diagnosed by malignant melanoma, he should seek frequently for skin examination to avoid this dangerous type of skin cancer. Next, please. Clinically, as we see, it's most aggressive, so we can find it anywhere on the body. It don't have a specific areas. Also, it affects the middle-aged people, so not only the elderly. It can happen in any, usually the middle-aged, between 20s and above. It appears on the trunk and on the lower limbs, in the legs. It's circular and irregular. Its borders from outside usually can be irregular border, can be flat, can be elevated. It happens in many different forms. It appears in combination of colors, like a brown, black, mixed sometimes with gray, blue, black, or even dull pink rose. Can we see the photo, please? As you see, this is the malignant melanoma. Some of you, first of all, when they see the picture, they will think this is just a nevus. And how how many we can count on all over our bodies that we have too much nevus, but nevus is different than malignant melanoma, and malignant melanoma we should taking care exactly because there is some types of nevus can be transformed. It starts as a nevus and it can be transformed to malignant melanoma. That's so aggressive. Next, please. So what will make us be aware if this is dangerous or not dangerous? Doctor, now you told us that there's many types. There it looking aggressive and it have metastasis. It can affect the body. As we see here, there is an alarming signs. The alarming signs we have in here for the malignant melanoma simply A, B, C, D. Okay. As you see the pictures above, this is the normal nevus. Okay, down this is types of melanoma. You will see the difference. A, it resembles a symmetry. As you see here, it is symmetrical in shape, color, everything. It looks all homogeneous, all the same. But in the melanoma, you will find that asymmetry. There is some elevations, some down areas, the border also be bordered. You will see here that the border, you can draw it continuously like an even border. But with the melanoma, usually it have irregular border. So if I have any nevus and I start to see it changing like that, so I prefer to examine it uh, more and more to exclude any malignancy. As you see also the color, if it is single color or one color in the nevus, this means I would suggest more that it's benign. But if it is having multiple colors, as I told you that the malignant melanoma usually having black, brown plus gray, it can be pink dull, but it's usually mixed colors. In the diameter, if the diameter is smaller, that less than fourth an inch, this also suggestive more of benign skin nevus. If it is greater than this, or it is increasing more and more than that size, so it also suggestive of malignancy, and we can take it serious and start to examine it. Next, please. Now, how to diagnose? For me, as a doctor, yeah, can you hold it here? Yeah. No, yes, thanks. How to diagnose? If the patient come to me in the clinic and then he's asking, Doctora, I have this one, now I'm suspecting it is good or bad, or how I know? First of all, I'm usually using the non-invasive technique, which is the dermoscope. Dermoscope, it is one of the newest clinical tool. I use it in the clinic to see the skin cancer or even the skin problem, but closely and very big. So I can distinguish if it is having more tendency to be benign or malignant according to its pattern, which is more detailed. I will not go in these details. Can we see the different shape of the, yeah, that's it. As you see, it just like a lens, but it is very magnifying it too much, so we can see directly. Can we see the patterns of the some patterns? As you see here on the right side, this is the nevus. If you look to it, and with the dermoscope, you will see that it's more closely bigger. I can distinguish the borders. I can see the sizes. La, can you go back, please? Yes, thanks. That we can distinguish there is different colors or no, there is a regular border or no. How is the pattern inside the nevus? That's also give us a very close idea about it should be or can be malignant or benign. So we will go for the second step, which is the skin biopsy. When we suspect by the dermoscope, first of all, that this nevus or this skin lesion can be harmful or dangerous or serious, so usually we seek for skin biopsy. As you see, this is the way how we are doing the skin biopsy. It is just sponge biopsy for some millimeters to take this skin part, and then we analyze it and see it under the slides with a very big magnification. And also there are some stains we usually use to distinguish what's the type, close type and shape of the cells. Next, please. We should also, to diagnose, we should do self-examination, but this is the rule of the patient himself. You should examine yourself once monthly. First of all, we can examine the body from front and from the back in the mirror, in a big mirror. Then we can check the right and left side and left arms. Second step, we should bend the elbow and look carefully at the forearms and the upper underarms, also on the palms, to see if there is anything changed or it's painful or it is itchy, its border become uneven, there is any change of something I know before or newly appeared lesion. Third step, we should see also the lower limbs, our legs from the back side with the hand mirror and also from the front side plus the foot. Number four, we should see also the scalp with a hand mirror and the neck from behind. Last thing is to see the back. We should check also the back and buttocks with the hand mirror. Next, please. Now, you will ask me, Doctora, you suspect something? Next, you now suspecting something which is bad, either the most common basal cell carcinoma, squamous cell carcinoma even, or malignant melanoma, and now we go for 100% diagnosis that it is one of the skin cancers. So how you will treat it? We have actually many different ways to treat the skin cancers. First of all, and the gold treatment, and number one is surgical removal. We should remove it. First of all, we should remove either the basal cell carcinoma or the squamous cell carcinoma or the malignant melanoma. The difference only in malignant melanoma that usually we take it as a wide excision. We give ourselves like safety border from the normal skin, then we excise it and remove. Number two, electrocautery. Electrocautery, we're using the electric current to locally destroy the cells. Usually this is so perfect with many types of the basal cell carcinoma and squamous cell carcinoma, but not with the malignant melanoma. Also, cryosurgery. It's also a type of destruction of the skin cells or the cancer cells by freezing. We freeze the tumor by the liquid nitrogen, which its temperature between minus 40 Celsius degree to minus 60. The last thing is radiation therapy. Radiation therapy, usually we use it in the malignant melanoma after even surgical removal. Next, please. Now we come to prevention. Doctora, we know the types of most of the skin cancers and how to diagnose it, how to examine myself, how to treat it to get an idea. Now, how to prevent. Actually, my work is in the sun. I should usually exposing, and I cannot stay far away for longer times. So you should at least put these 3 points in your mind. First of all, avoid the sunburn. Sunburn, usually it happens in the peak timing of the ultraviolet ray presence between 10 a.m. to 4 p.m. Sunburn, this is a direct exposure of the sun, of the skin to the sun, direct ultraviolet ray, especially ultraviolet B or UVB, which is causing sunburn, and it appears like too much redness, discomfort, and burning sensation in the face or in the exposed area. Usually, this happens for most of us during swimming, especially in this summertime. So you should avoid the sunburn, please. Sun exposure in the peak timing. This is the peak timing. No, can you go back a little bit? No, can still. Yeah, thanks. Number two, we should use the broad spectrum. No, can you go back for the prevention? Still, we didn't finalize it. Yeah, thanks. We should use a broad spectrum sunscreen. And this is one of the most important things in our hands is choosing sunscreen. There is many types of sunscreen in the market, many formulas, but you should first of all thinking about to protect you, fully protecting your skin from ultraviolet A, ultraviolet B, UVA, and UVB. So you should choose it as a broad spectrum sunscreen. Number 3, you should examine your skin by the same way that I examined before, I explained before, once monthly at least. Next, please. Now I will give you some hints about the sunscreens briefly, just to know when you're going to, there is one more. When I'm going to the pharmacy to choose a sunscreen, or even asking my doctor, so which type? There is 100 types. First of all, as I told you, you should choose the broad spectrum sunscreen that block UVA and UVB. UVB is the most dangerous type of ultraviolet rays, and it's this is the one who's responsible of most of the skin cancer problems, UVB. So first of all, you should see that it's writing broad spectrum, block UVA and block UVB mainly. Number 2, sun protection factor. When you choose your sunscreen, all of us know there's something written SPF 30, SPF 15, SPF 100. What's that? This is the sun protection factor. This sunscreen will give you a protection from the sun by how many percentage? But this percentage, the 50, it's not mean like you are protecting your skin by 50%. No, more than 50, protecting your skin by actually almost like 98% protection of your skin. There is 30%, doctora, so I don't go for 30%. No, 30% is good, but it's better if I'm exposing too much and I'm usually outside in the peak time of the sun exposure. I should have it more than 50. Number 3, the sunscreen. It should be applied to your skin 30 minutes minimum before you expose to the sun. At least 30 minutes before exposure, and also to know that the effect of the sunscreen only lasts for 2 hours. So you should reapply it later on after 2 hours, or even if you are in a shaded area, and then before you go again, you should apply it another time. Last of thing is sunscreens. You should choose the suitable type according to your skin, because there's many formulas of the sunscreen which is good for the oily skin, for the dry skin, or even for the normal skin. Because these formulas can actually, if you use wrong formula, this can give you some complication like acne. It increases the acne production, some things on the skin. So we should either to know which type is suitable to your skin, or to advise or take the advice from your doctor. This next, please. These some types of the most common sunscreens in the market. There is more and more, even more than these by many, but these are just an example. Thank you so much. I hope that you enjoyed the lecture and it's helpful for all of you.
I would like to thank Dr. Iman for such a useful and helpful hints and beautiful presentation. It was really needed, especially in summer, and I mean, everyone should know how to protect his or her skin. Thank you so much, Doctora. It was a pleasure to have you on board with us. At the end of the day, I would like to request all the audience to subscribe to our YouTube channel, to stay tuned for our upcoming webinars. Thank you so much, Doctora. See you soon, inshallah.
Thank you, Dr. Iman.